One of the most common questions after a cancer diagnosis is, what am I supposed to eat now? Online information about anti-cancer foods can be confusing, inconsistent, and rarely answers practical questions such as how much to eat, how often, how to cook, or whether there is real scientific evidence. This leaves patients unsure about what to actually follow in daily life, based on more than 10 years of clinical experience with cancer, patients, and extensive research. This video summarizes 10 food groups that are helpful during cancer treatment and recovery. These are not trendy superfoods, but foods selected using 5 scientific criteria: immune support, positive epigenetic influence, modulation of cancer stem cell behavior, improvement of the gut microbiome, and anti-aging mechanisms. These criteria are based on well-known research on the hallmarks of cancer, as well as newer studies on microbiome and epigenetics. 10. Low-fructose fruits. Fruit is convenient and pleasant to eat, and many patients consume it in large quantities. However, recent studies suggest that excessive fructose may fuel tumor growth and metastasis in certain cancers. This does not mean fruit must be avoided, but choice and quantity matter. It is better to focus on fruits. Lower in fructose and reduce very sweet fruits, juices, dried fruits, honey, syrups, and sugary beverages. Certain teas may help reduce fructose absorption, and light walking after meals can help muscles utilize glucose more effectively. 9. Small white-fleshed fish. Fish vary significantly in heavy metal content and fat composition. Larger predatory fish accumulate more mercury and lead. Small white fish provide clean protein and beneficial fats with fewer contaminants. These should be seen as part of a balanced diet rather than as a cure. 8. Whole grains, especially germinated brown rice. White rice is easy to digest but nutritionally poor. Whole grains contain fiber, minerals, and vitamins, but brown rice can be tough for some to digest. Germinated brown rice improves digestibility and increases beneficial compounds such as GABA, gradually replacing white rice with whole grains. Or using porridge-style preparations is a practical approach. 7. Seaweeds. Research on the world's longevity hotspots, the blue zones, shows dietary patterns rich in seaweed, small fish, vegetables, grains, and legumes. Seaweeds offer minerals and prebiotic fibers, and may have protective effects against cancers such as breast, colon, and liver. Simple, consistent intake is more important than complicated routines. 6. Nuts and seeds. Nuts and seeds provide plant protein, healthy fats, and micronutrients. Studies link daily nut consumption with lower cancer mortality and reduced recurrence in several cancers. Walnuts have especially favorable omega-3 to omega-6 ratios. About 1 to 2 small handfuls per day is a practical goal. Highly processed nut butters and oils high in omega-6 may promote inflammation and are best limited. 5. Mushrooms. Mushrooms are rich in beta-glucan, which supports immune function. Beta-glucan has shown anti-cancer activity and survival benefits in various studies. Rather than relying on extracts, frequent culinary use of mushrooms in soups, stews, stir-fries, and rice dishes is effective and accessible. 4. Cold-pressed perilla oil and flaxseed oil. Cell membranes are made largely of fats, and their flexibility influences oxygen and nutrient transport. Modern diets are often overloaded with omega-6 fats and deficient in omega-3. Cold-pressed plant oils help restore balance and should not be heated. They serve as finishing oils or dressings, and can be mixed with soy-based yogurt for better absorption. 3. Soy and legumes. Adequate protein is crucial during cancer treatment. Soy and legumes provide clean plant-based protein and fiber, without the metabolic burden of excessive animal fat. Research shows that whole soy foods are beneficial or neutral in various cancers. Concerns about soy-feeding breast cancer are largely outdated. The caution applies mainly to high-dose isolated isoflavones, not traditional soy foods such as tofu, miso, natto, and unsweetened soy milk. 2. Fermented foods. Gut microbiome diversity is linked to treatment outcomes, immune function, and survival. Cancer patients often exhibit reduced microbial diversity due to surgery, chemotherapy, radiation, antibiotics, and pain medications. Fermented foods and dietary fiber are among the most effective ways to increase diversity. Fermented soy products such as kimchi, miso, and cheonggukjang may offer direct anti-cancer effects and support beneficial microbes. 1. Vegetables. Across major cancer and public health organizations, the consistent message is that vegetable-centered diets are most protective against cancer and chronic disease. No single superfood matters more than dietary pattern. Studies suggest that 400-800 grams of vegetables and fruits per day reduce mortality, with half the plate at each meal. Devoted to vegetables being a simple guideline. For some individuals, green juices can help increase intake, while for others, especially those who are cold, underweight, or digestion sensitive, warm vegetable soups are better tolerated. This information does not replace medical treatment, but offers dietary strategies that support the body through therapy. Change does not need to be immediate or perfect. Small steps and personalized adjustments are more sustainable. The goal is to build a diet that nourishes rather than burdens the body during a vulnerable period.